everyone.
Hi.
नमस्कार नमस्कार डॉक्टर साहब, कैसे हैं आप?
बिल्कुल ठीक हूँ, आप कैसे हैं?
बढ़िया से। Very good evening to all the viewers of Riches Multi Services. I am here again, founder of Riches Multi Services, Dilmeet Kaur, live from the very own page of yours, Riches Multi Services, on Facebook and Zoom as well. We are blessed and proud enough to inform you all that we have started our health and supplement wing very effectively and in full-fledged mode. And we are here to inspire you all and acknowledge you all and provide you with knowledge related to all products as we are doing in our other segments. For any other information or any feedback that you want to give, please log on to www.richesmultiservices.com. We have a Facebook page also from which we are live. We have our Twitter account as well as Instagram handle. For any queries, you can send us a WhatsApp message also on 991997978. So let's go ahead with the introduction of our guest. We have Dr. Shekhar Shrivastav with us, who is the founder of Prime Clinic in Delhi and has an experience of more than 20 years in orthopedics. Very well said by Albert Einstein. Only a life lived for others is a life worthwhile. This is the best example that is proved by the doctors. We can see during these tough times also, they're working from head to toe, day and night. We are really very thankful to all the team of the doctors, all the front warriors that are there to help us, that are there to protect us. Thank you so much. So going ahead with the introduction of Dr. Shekhar, he has been awarded as the Rising Star in Orthopedics for the year 2018 in Delhi by Times of India and is a consultant for very good hospitals, like Max and many others. So the topic for today's discussion will go ahead with knee treatment, shoulder treatment, others. But first of all, I would like to ask Dr. Sir, Dr. Shekhar, what is you are practicing in your clinic?
So, thanks for the generous introduction. And so I've been an orthopedician since 1999. And initially, as a general orthopedician, we used to do everything, starting from trauma to spine. But slowly, I specialized into knee and shoulder work. So my main area of specialization is managing knee and shoulder problems. Especially, I am more keen in managing the problems of the young persons, which includes the ligament injuries inside the knee joint, as well as in the shoulder joint. In older persons, we all know that the knee problem is quite common, and joint replacement has become very, very common in our country. So we are also doing lots of joint replacement, both at Sun Permanent Hospital and the other hospitals where I go. So our main area of focus is managing knee and shoulder problems in all the patients.
Great. So one thing more that we want to know is, what sort of work and what services and what type of treatments we are mainly focusing in the clinic. You have your own startup in by the name of Prime Speciality Clinic. So what is the main area that we focus upon there?
So we started this clinic in 2017, and with the purpose of setting up a modern world-class OPD center in the eastern part of Delhi. So this clinic is focusing mainly on orthopedic patients only, and we have all the facilities for the outpatient department, for the outpatient management of the patients, of the orthopedic patients. So we have got chambers for the doctors, but we only encourage orthopedicians to come here to see the patients. Then we have got all the diagnostic modalities. We have got the pathology department. We have X-rays, and then we have a very good physiotherapy department, because we know that in orthopedics, the exercises and physiotherapy matters a lot. So we try to cater all the aspects of orthopedics in our clinic. As we know that orthopedics is becoming quite vast, and there are different specialties, specialists for each branch. So for spine, we have another doctor, Dr. Amit Sridhar, who comes to our clinic. I focus mainly on knee and shoulder. And then we have a general orthopedician also, Dr. Prabhat Agarwal. So that way we try to cover the whole spectrum of orthopedics in our center.
Wow, we have all the services that a patient needs, and that too, the most important point that we have at your clinic is that we have an expert who has more than 20 years of experience in the field of orthopedics. So I would like to ask, like, what are the common problems related to shoulder that anyone can face? Like, we all know that bone strength is, of this age group is not as like it was before. So, like, knee problems, shoulder problems are quite common. So, what are the common shoulder problems that we are facing these days?
So, shoulder is often a very neglected joint. Many times you see that the patient will keep complaining of pain or stiffness in the shoulder, and they have been advised just to keep it moving or just do a rotating wheel kind of thing. But it is much more than that. There are so many important structures inside the shoulder joints which has to be diagnosed properly. Only then you can treat them properly. Now, if you talk about the common problems seen in shoulder, now it varies according to the age of the patient. Like in young patients who are very active, who are into sports, okay, like age group of, you can say, 15 to 30 years. In those patients, the main problem we see is a repeated dislocation of the shoulder. You must have heard that the patient the shoulder comes out of the socket and comes back in. So these happen usually in patients who are involved in overhead sports like badminton or volleyball. So these kind of patients have this kind of problem, and that is the main problem which we see, and that requires either exercises, and sometimes it needs to be operated. But patients older than that, say 40, 50 and 60, in this age group, the commonest problem which you see is frozen shoulder. Okay. Now, all of you must have heard some of your friend or relative who had this problem, the frozen shoulders. It's a very common, very rampant problem in our country, especially because India has a huge population of diabetic patients, and frozen shoulder is commonly found in patients who have diabetes. So we see a lot of patients who have frozen shoulder, and fortunately, most of the problems
I think there is some network issue from the side of Dr. Shekhar. Dr. Shekhar, are you able to connect with us? So by the time he joins us, I would like all of you to know the website of his clinic. It is www.delhiarthroscopy.com. Let's start again. He's here again with us. Hanji. So, sir, I have just announced your website with our viewers. I have told them about the website. It is www.delhiarthroscopy.com. So we can please go ahead with like you were telling us about broken shoulder or displaced shoulders.
Yeah, so frozen shoulder is the commonest problem which is seen in this kind of patients. And in elderly patients above 70 to 80 years, there you see arthritis. So similar kind of arthritis which you see in knee patients, you see in shoulder patients also. So this is the common spectrum of orthopedic problem which you see. Okay.
So this shoulder problem also includes arthritis.
Yes, yes. Though it is not as common as knee joint, but the shoulder arthritis does exist. And yeah, so in patients who are above 20, you do get patients of shoulder arthritis who always keep on complaining of pain in the shoulder. In fact, sometimes it is so disabling that it also disturbs their sleep. They are not able to sleep properly. So that has to be tackled. Like the way we do knee replacement, similarly there is shoulder replacement also. Okay, and it gives them very good relief.
Thank you so much, sir. Like this one is something which very few of us know. And our next question is, we want to know the common knee problems that we face. Like shoulder arthritis is something which is introduced new to me at least, and many of us like what are the common knee problems that we face in today's life, and or you can say since young people are facing the knee problem very frequently. Why is it so?
Yes, you are very correct. Now, you must have heard many people saying कि वो हमारे दादा दादी तो इतने लंबे समय जीते थे और उनको कुछ नहीं होता था. But we have started getting this knee problem. Why is it so? Now there are reasons for that. First of all is that our life has become very sedentary. Most of our profession, it does not involve a lot of physical activity. We have to sit in one position, and mostly we are working either on computers or everything is so automated that we are not actually using our body so much physically. Okay, so that's why our body is not getting enough exercises. So that's the main reason why these knee problems are happening more and more. Now, knee arthritis develops because of wear and tear, aging. Now, aging is a normal process. Everyone ages. But if you don't exercise your muscles, if your weight increases, if your nutrition is poor, if your bones are weak, all these things will lead to arthritis later on. Okay. So what you do now at the age of 20, 30, 40 will get manifest at an age of 50 to 60. If you maintain a healthy lifestyle at this point, do proper exercises, maintain your weight, take proper calcium, maintain your nutrition, you will have good knees at the age of 60. Okay. But if you don't do all these things, you are not doing proper exercises, आपके खाने में सिर्फ घी तेल मसाला है, प्रोटीन कम है, कैल्शियम कम है, so naturally your body is not getting enough nutrition, and in that case at a very early stage 50 to 60 years you will start developing arthritis. Now there is a factor of familial thing also, genetic. Some persons are more prone to develop arthritis, but that is not the only thing. You cannot just say कि मेरी तो family में था मैं तो कुछ नहीं कर सकता था, ऐसी बात नहीं है. That is one factor, but second factor is within your control. Okay, the lifestyle. So if you maintain a healthy lifestyle, this problem can be managed. So this is the problem in elderly patient. But in young patient, what we see nowadays is injuries. Injuries in the ligaments and other structures inside the knee joint, because now we also see more and more patients who are getting active in sports.
I think there is some connection error.
Yeah. Can you hear me?
Thank you.
now? So in young patients, what happens, there is ligament injury because of active participation in sports or in gyms and all. So that is the second group of patients which we see, the young patients. But most of the patients we see are elderly patients with knee arthritis. So those are the common knee problems which we see.
So any particular suggestion that you would like to give to the people who are under the age of 30, like they can maintain their bone health since they are young right now?
Oh, yes. First of all, you need to maintain a healthy lifestyle. Now that includes proper nutrition, exercises, and also adequate rest. Okay, rest is very essential because your body heals during resting phase. If you don't allow it to heal, slowly it will lead to further deterioration and wear and tear. So that is one part. You need to have proper nutrition. Indian diet is very good in carbohydrates, but it is slightly poor in proteins and calcium. So you need to include more of proteins. Now, in case you are vegetarian, then you have to add all kind of pulses or soya products. If you are non-vegetarian, then it's okay. You can add eggs or any white protein or white meat kind of thing. And third is you need to tone up your muscles. थोड़ी सी exercise चाहिए, just half an hour, okay? And fortunately, in our country, yoga is such a nice thing. If you do proper yoga, it does proper strengthening as well as stretching. So that's an excellent exercise to follow. So if you do all this thing, then your knee, shoulder are going to be great at the age of 60 also.
So we have some very good suggestions from Dr. Shekhar. Have an active lifestyle, do exercise, take proper nutrition, and above all, take good sleep also. I think that is the most missed part that we are facing these days. Because of the so much tensions that we take, the work-life exertions, and so many other things. So Dr. Shekhar, we are really very grateful to you that you have joined today with us. So before you leave and before we say goodbye to our audience, I really want to know and discuss about the future programs or activities that we are going to do in order to engage our audience as well as increase their knowledge on this part.
So I think there are many misconceptions about many common orthopedic problems. And if you don't have knowledge, then sometimes you get worried, you panic. So what I would like to do is to discuss some very basic facts about some common orthopedic problems, which we all of us face at some point of time. And it will give you some idea about the problem, so that if you understand that problem, that you won't panic. We can also discuss some of the common remedies which you can practice at home, which will help you keep healthy and which can help you in avoiding those problems. So that's my plan, and I think we can discuss it together, that what sort of common orthopedic problems which the common person faces. And we can take one topic at a time and we can discuss it, the basics of that, just the basics of that.
That's really very nice of you, sir. So our next discussion would be about the misconceptions that we have about the orthopedics problem, as well as what sort of precautions that we can take, and that too about particular parts of the body. So stay connected with us, and before you leave, let me remind what your company does. It is taking care of all your investment needs, your health and supplement needs, beauty and grooming consultations, astrological consultations. So and all the educational online and offline courses. You can go through our website. You can get in touch with any of the executives and get the details for the same. I'm again reminding you all, you can also visit the website of Dr. Shekhar Shrivastav, www.delhiarthroscopy.com. Till then, stay happy, stay safe, and stay healthy. That's all for today. Goodbye.
Thank you. Thank you.